Welcome to a new podcast, which title is Human Sexuality. I am Alberto Bali. I am an obstetrician, a gynecologist, a human sexuality specialist, and a sex therapist. What we are going to start today, I think that is not the final product, but it's one of the products of having realized almost 50 years ago that there is a huge need of information, clear communication, and the need for diagnosis and management of so many sexual problems that so many persons, men and women, have during their lifespan. We will talk clearly. We won't talk with hesitations. We will call the things in the way scientifically, professionally, responsibly. We need to talk. This is the objective of this podcast. To educate you like nobody have talked to you about sex and human sexuality, for the good, for the bad, and for the ugly. Thanks God, I have a huge support with me, which is Dr. Domínguez. Catherine, thank you for being here.
Thank you for inviting me. I have worked in the area of pediatrics, obstetrics, gynecology, and for the last 20 years, human sexuality. During my practice, I have noticed the need of communication, more intense communication between parents and children, and also physicians, providers, and patients.
We don't do that. Unfortunately, we don't do that. Physicians don't feel comfortable talking about sex. Despite that, in the last 10 years, we have seen an explosion of seminars, courses, update seminars or symposiums regarding why and how physicians should talk about sex and do a sexual history and physical. We are still having more than 60% of physicians who don't like to talk about sex.
Well, we also are assistant professors for a university, and we, with our students, realize that the word sex is still taboo.
Women and men have a lot of issues and questions and doubts about their own sexuality or their sex of their partner. And they have learned, because that was what was taught, not to talk about that. So despite that, many patients has the need to talk about sexual issues. Rarely they talk about that.
I think part of the reason is really because they are not familiar with it. They are not in tune to their what could be potential diagnoses. Why are they inhibited? They've never had an orgasm. We have had patients in their 80s who've never experienced an orgasm.
That's true.
They don't know what it is.
The whole life without an orgasm. I would like to ask to a man what you would like to do, or how you tolerate to have sex for 40, 50, or 60 years and never to reach an orgasm. That is unacceptable in a male. However, there is a very good number of women who never have experienced an orgasm, having 6, 7, 8, 9, 10 children. That doesn't have to do one thing with another. One thing is reproduction, another thing is human sexuality, alias pleasure. That is one of the programs that we will dedicate in the future to clarify those two aspects, that despite that has been tried to be mixed really they are totally independent.
However, when we visited Cuba, it was interesting to me to realize that a young adult could come home and tell her parents how she had sex, with who she had sex, and what she received for having sex for that person. And she received food for the pigs for the next 6 months.
Well, the socio-political condition of the country have made that women in many occasions trade that sex for the most basic needs in our life. That is happening today. We just finished an investigation in which we analyze all the consequences of the massive immigration process to United States, the highest immigration in the history of United States. That has been reflected in all the areas of our economy, including the public health. And in the public health, we have seen how the sex traffic, how the abortions, how the ectopic pregnancies, how the sexually transmitted diseases, how the woman who has decided to get involved as a sexual worker to be the faster and easiest way to have an income have increased significantly in the whole country. In our area, South Florida, that has been clearly found with the amount of especially Latin American people that has come. So, sex has been one of the most important forces, biological and evolutionary forces of our life. Has been also a way to die, a way to celebrate, a way to work, a way to maintain. Because it's very rare the area of our life that is not influenced by sex. That's why we are here. How many cases every day we have, and we discover they are coming for another thing to our offices, to our clinics. For example, why you come today? No, I am coming for a regular checkup. I am coming for a pap smear. And what we'll find?
Well, a lot of times when there are minors, minor is somebody under the age of 18, the mothers will bring them to the gynecologist. These girls many times are already sexually active and live in a whole different atmosphere than what the parent knows. Yes, they don't know what the child is really doing. There's a very popular practice now where the children will have a party, children being ages of 14, with older men in their 20s, and they consume drugs, or they take a drink that's laced with another product that inebriates them and creates an environment for sexual pleasure amongst the older men, and the girls wake up not knowing what took place. They come to our clinic, we've had several, the mother doesn't know what's wrong with the girl, or just wants to check the girl out, or feels something suspicious. But the center that we have creates an environment where the person can really divulge to the practitioner what happened. And many times we discover, and we do the sexual transmitted disease checks, and we discover chlamydia, gonorrhea, pregnancies, unplanned poor outcomes for the child. So basically informing the child that their mom or father is their best friend, because they took them here to the doctor.
We take advantage of a visit like that to do something that require another program. We will have it. To do something that we know very scanty number of parents, I could say 1 in 1,000, talk to their children, which is the aspect of pleasure. So most of the time, these girls are brought to our office for 2 reasons by the mother. It's very rare by the mother and the father, mainly by the mother, because she is having irregular menstruations and they want to know what they can do, or because they are suspecting, or because they know that the girl is going to have sex or is having sex, and of course they don't want that she get pregnant. So those are the 2 main reasons why an adolescent girl is brought to our office, sometimes at 12 years old, 13, 14, by their moms. And I take advantage to talk with the girl and with the mother about sex. And the first thing that I need to tell them is, or to ask them, if is she enjoy to have sex. Most of the time, those girls never have had an orgasm, despite to have been with 1, 2, 3, or 4 guys. She never have had an orgasm. That is very frequent. In the case that they have had an orgasm, the next question that we provide is, do you really enjoy it? And of course, the answer is yes. Then I go to the point of enjoyment and pleasure, and I tell them, do you know that is not bad, that is not a sin, that is not something against our nature to masturbate? Do you know that masturbation produces you the same pleasure that can produce a sexual activity with the risk of pregnancy or sexually transmitted disease? Of course, it's more complete a relationship with the partner you love, with the partner you want to be, touching her skin, his skin, making the whole act a real pleasurable action. But you need to know that it's important, first, that you don't go to the bed with every person who tried to have sex with you just because pleasure, or because the pressure that the guy put on you, because you can get pregnant. And the first thing that you need to do is to avoid to get pregnant. Reason why your mom is coming here. But also, you don't know really how the guy is coming. If he has conquered you to have sex, most probably he has had sex already with other girls, and most probably he can transmit you chlamydia, gonorrhea, syphilis, HPV, human papilloma virus, or herpes. And any of those diseases can damage your reproductive system and make you to be an infertile woman in the future. Take the time in that moment to talk to the girl and talk to the mother in that way. Tell them, teach them that you can talk about sex in a serious, professional, respectful manner, in a truthful manner. So these are the kind of things that this podcast try to promote. To be able to talk about penis and vagina without making the people to start to laugh. Say in any meeting, in any party, penis, or say vagina, and without saying anything else, you will see that most of the people around you will start to laugh. Why? Well, sex has been taught mainly in a joking way. Jokes are done mainly with sexual issues, and that is the way people respond. Laughing.
Dr. Bali, let me ask you a question. Let's say a young person is watching us now And their environment has not even been one that their parents have allowed them to speak about menstruation, their first menstruation. So they're not comfortable with speaking to their parents. Tell me, how do you suggest they approach a mother who, as we've heard, is either very religious or against relationships of dating? What would be your initial approach to the parents?
Well, there are so many things that we can say just with the parts that you named. First of all, sexual education at this moment, still at this moment, should be more directed to the parents than to the children. Parents don't know how to talk about this. Not all of them. I am finding every day more parents that has been able to understand that they need to talk with their children about the things that they know. For example, a father knows that his daughter at the age of 16, 17, 18, 19 start to be a sexual symbol in which all the men around will place their side. And just to know that, he could say it. He could say, my love, you need to know that you are a very pretty woman, that you call the attention, that you are really beautiful. Not only beautiful in the sense of beauty, no, beautiful in the sense in which most of the men think about, which is sexually attractive. And the fathers need to, if he haven't talked about what is sexual attraction with his words, with his experience. He doesn't need to be a psychologist. He doesn't need to be a physician. Just with his human experience as a male in our present society, he should talk with his daughter regarding that she need to be aware of that she need to know that they will do whatever they can in order to take her to the bed. And what are the risks of that kind of behavior? What are the problems that can produce as a consequence of that kind of activity? Children, I could say that since 9 years old, need to start to know about sex. We shouldn't make speeches. We shouldn't say, come, let's talk today about something that is very important in your life, and start to make a speech regarding sex. From a macho man point of view, or from a psychologist well-informed point of view. Sexual education is something that takes place every day. In the moment in which we eat with our family, in the table.
Well, I remember in school, in 8th grade, 8 a.m. class, the teacher, in a very religious school, the teacher went around the classroom, and I think he gave, in his own way, one of the very best pieces of advice in a very nice way, in an acceptable way. And he said, now we're in 8th grade. All of you are beginning to develop. The women are going to have their menstruation. The boys are going to be attracted to the women. And you might be asked out on a date. What are you going to do on the date? And the advice he gave, please, before you go out on the date, make sure you can kiss all the time. You can have sex all the time, anytime in your life. But before you go out on this date, I want you to have in your mind what you will do. Will you hold hands? Will you kiss? What will you do? And stick to it. And of course, that's without any substance use of alcohol or drugs. And that that piece of information was very helpful to me, myself growing up, because it's true. You can always do something, but you can't take it back.
People need to know, parents mainly, but no, also the children, especially the women, the adolescents. Because this is a problem that you and me see, I could say without exaggeration, every week. We'll see 1, 2, sometimes 3, 4, 5 cases in which the girl have gone to a party, to a discotheque, in areas that are hot in South Florida. And they are, of course, excited to share with their peers that moment. And there are people around that are hunters, and they usually get the person who use substances that they put in your glass of Coca-Cola or lemonade, or inclusively an alcoholic beverage. And you, after that, don't remember anything. And they have wake up in the middle of a room, totally naked, surrounded by other pieces of dressing, including condoms around, and they don't know where they are, what happened. And if they, usually they don't say this story, they don't share this story. They keep it inside, they dress, they get out of the place, they go home, and that is kept. This is the moment to say that 12% of sexual abuse is the amount of abuses that are reported, which means 88% of sexual abuse never happened. On a daily basis, we do a sexual history. In the sexual history, always we have you been sexually abused in any moment of your life? And around 40 to 50% of our patients say yes. What was the problem at what age? This one, that, and that. Did you report that to anybody? In 90% of the cases, the answer is no.
To that sexual history regarding abuse, I also ask, did anything happen to you as a child? Because if you say, have you been sexually abused? They feel, have I been raped as an adult? But also clarifying is as a child as well. And many times they have reported it to a mother or an aunt, and the mother has made them feel either dirty or that the child was provocative to the uncle or the stepfather, and actually the child was at fault. I had the other day a 60-year-old woman sitting in front of me who was crying, and I asked her what was wrong, and she said, you know, you asked me if I was abused, and I told you yes, I was abused. I was abused from the age of 5 to the age of 13 until I could run away from my house and escape my stepfather. And do you believe me? And I told her, yes, I do. And she was crying because she said, in my whole life, I think I could feel like I'm healed now because I found somebody in the world who could accept that that actually happened to me.
This is a point in which I need to say something that is so hard and is so bad, for which we will dedicate in the future one of the chapters of this podcast. But it's not rare to find a girl that take the decision to tell the mom that the father or the grandfather or the aunt or the cousin or the brother abused her. But if the abuser is the person who provide the economical support to the family, most probably she has a very high risk to receive from the mother no support and to receive the expression that she doesn't have to lie, that she was provocative, or that he, the guy, the abuser, never will be able to do that. And I am sure that in the bottom of her mind, mother's mind, the main reason is not that the child is lying, but that she cannot place in dangers the guy who supports the entire family. And this is something that is covered by the mom, consciously or unconsciously. That deserves a whole program for that kind of situation. But I need to tell you that the daily newspaper, take anyone, give you how important is the pandemia in the nation, in the world, perpetual, continually found and indifferently seen of the sexual abuse. In any newspaper, choose anyone, any day, you will find 3, 4, 5 articles about sexual abuse in one way or another, from the president of this nation to the guy who worked in the maintenance of the hospital. At any level, that is a pandemic that we have, and that is one of the late consequences of inappropriate sexual education and the lack of communication between all of us about one of the most important functions of a living being, not of the human being, no, of any living being.
In the area of pediatrics, I found it very interesting the amount of cases of sexual abuse. And I know you have history with being a pediatrician. Did you find that in your area as well?
Yes, definitely. The first serious study that I did in my life was when I was in the second year of the residency in pediatrics in Colombia, South America, because I realized how many children were abused, mainly by the members of their families. Not only girls, but also boys. And how the parents didn't know or knew, but they didn't take any action regarding that.
Well, you know, something that was said to me when I was in nursing school, when a boy was sexually abused and had to have a colectomy.
For that kind of trauma.
Yes, from his grandmother. And what ended up happening, I was told, this is not a popular area to discuss with any physician. You just need to keep it quiet. And I didn't understand why. And the mother actually worked for the pediatrician, and the outcome was that the pediatrician that reports a sexual abuse victim, the case, the family, the lobby will be empty, because there will be, in case your child goes there and has a fractured leg or arm, was it an abuse issue? This is a doctor who reports sexual abuse and physical abuse, so don't go to him. That's what I found out was a common thought amongst the pediatrician.
Our life in the areas we have been working for decades are really places full of this kind of problem. I could say that in any level of our society, you will find the consequences of inappropriate sexual education and all the problems that people who are abusers for not having an appropriate education produce. So this podcast which today we have been informally talk about what came to our minds, not planned to talk. It's an invitation for all of you to follow us in order to have a better life, not only for you, but also for your children and for your grandchildren.
And the experiences are brought to make everyone aware that these are real cases, that this really could occur, and to have your children develop protecting themselves, a protection against it, and be self-aware and open with a parent or grandparent, the matriarch or patriarch of the family, in order to always have the potential to speak about anything that comes to their mind.
We will try to invite professionals that can talk about these subjects in their area of expertise: psychiatrists, psychologists, and other sexologists and other sex therapists. We will do it mainly. We are convinced of our good intention, the need of this kind of information for everybody, including children. We are in total disagreement to those programs in which when somebody are going to talk about sex, the parent or inclusively the producer of the program says, well, this is a moment in which you need to send the children to the bed. No. It's like the mother that is going to have a pap smear and open her legs, and they tell the children, a boy or a girl, my boy, my love, get out of the room. No, that is an experience in which they see that mom can be examining the genitalia without any problem, that there is a need to examine mom in the genitalia that in the same way that there is a need to examine her heart with a phonendoscope. So that kind of moment, this kind of moment should be given to everybody. And if somebody, because it's small, have question because certain expressions of or words that we use are not clear, you are there to explain them with your plain knowledge. That's enough. But this is extremely important, and we are willing to do it, because every single day we see a lot of people with a lot of problems and nobody talks to them.
Thank you for joining us, and through this area of education, we desire to improve lives. See you on the next episode.
Thank you so much.